What happens after prorenin is converted into renin and secreted into circulation? Plasma renin then carries out the conversion of angiotensinogen, released by the liver, to angiotensin I. Angiotensin I is subsequently converted to angiotensin II by the angiotensin-converting enzyme found on the surface of vascular endothelial cells, predominantly those of the lungs. What does angiotensin II do in the body? Potent vasoconstrictive peptide, stimulates secretion of hormone aldosterone from adrenal cortex, causes renal tubules to increase in reabsorption of sodium and water into the blood while also excreting potassium. What are the general mechanisms of actions for sympathomimetic drugs? Heart, the adrenergic receptors, increased heart rate, increased contractile force, increased automaticity. Systemic, adrenergic receptors, vasoconstriction. B adrenergic, vasodilation. Lungs, adrenergic receptors, mild bronchoconstriction. B adrenergic receptors, bronchodilation. What are some examples of sympathomimetic drugs? Epinephrine, albuterol, dopamine, norepinephrine, isoproterenol. What is the general actions for sympathetic blockers? Class of drugs that antagonize adrenergic receptor sites, reduces heart rate, reduces contractile force, lowers blood pressure. What is the general mechanism of action for antidysrhythmics? Useful in treatment and prevention of cardiac arrhythmias by either slowing or speeding up the heart. What is the general mechanism of action for parasympathetics? Drugs that inhibit the actions of parasympathetic nervous system. Also known as anticholinergic stimulation, induces peristalsis and causes pupillary constriction and a decrease in heart rate. What is the general mechanism of action for anticoagulants? Drugs that inhibit blood clot formation, used for acute coronary syndrome, acute embolic and thrombotic strokes, pulmonary embolism and deep venous thrombosis. What is the general mechanism of action of fibrinolytics? Drugs used to dissolve a blood clot. 3 main types: streptokinase, anisplase, alteplase. What is the general mechanism of actions for alkalizing agents? Used to buffer the acids present in the body during and after cardiac arrest. What is the general mechanism of actions for cardiac pain management? Drugs that have proved effective in alleviating pain, block the cyclooxygenase enzymes and reduce prostaglandins throughout the body. As a consequence, ongoing inflammation, pain, and fever are reduced. What is the general mechanism of actions for diuretics? Increases cardiac output, and to reduce pulmonary and peripheral edema. They act by diminishing sodium reabsorption at different sites in the nephron, thereby increasing urinary sodium and water losses. What are the general mechanism of actions for antianginal agents? Reduces cardiac output and perfusion of ischemic myocardium, equal reduction and alleviation of chest pain. What are some examples of phosphodiesterase inhibitors? Viagra, Cialis, sildenafil, vardenafil, tadalafil. What do corticosteroids do? Both kinds. Corticosteroids are classified as either glucocorticoids, Anti-inflammatory which suppress inflammation and immunity and assist in the breakdown of fats, carbohydrates, and proteins, or as mineralocorticoids, salt retaining that regulate the balance of salt and water in the body. What class of drug corresponds with the suffixes azone, olone or onide? Corticosteroid. What are some examples of corticosteroids? Betamethasone, dexamethasone, defloresone, fluticasone, mimetasone, hydrocortisone, loprednol, prednisone, prednisolone. What is the general mechanism of action for barbiturates? They cause central nervous system depression. This is brought about by stimulating the inhibitory neurotransmitter system in the brain called the gamma-aminobutyric acid system. What class of drug corresponds with the suffix butyl? Barbiturates equal sedatives. What are some examples of barbiturates? Butabarbital, phenobarbital, secobarbital. What class of drug corresponds with the suffix cane? Local anesthetics. What are some examples of local anesthetics? Lidocaine, prilocaine, proparacaine, bupivacaine, mepivacaine. What class of drug corresponds with the suffix -cilin? Penicillin antibiotic. What are some examples of penicillin antibiotics? Amoxicillin, ampicillin, oxacillin, nefcillin, dicloxacillin. What is the general mechanism of action for calcium channel blockers? What class of drug corresponds with the suffix diapine? Calcium channel blockers. What class of drug corresponds with the prefixes cort or pert? Corticosteroids. What are some examples of calcium channel blockers? Amlodipine, felodipine, nifedipine, nimodipine. What class of drug corresponds with the suffix eprazole? Proton pump inhibitors. What are some examples of proton pump inhibitors? Omeprazole, esomeprazole, raprazole. What is the general mechanism of action for non-steroidal anti-inflammatory drugs? Inhibition of the enzymes that synthesize prostaglandins. Prostaglandins cause inflammation, pain, and fever as part of the healing process. What class of drug corresponds with the suffix phenic or profen? Non-steroidal anti-inflammatory drug. What are some examples of non-steroidal anti-inflammatory drugs? Bromfenac, diclofenac, ibuprofen, ketoprofen. What class of drug corresponds with the suffix iramine? Antihistamine. What is the general mechanism of action for antihistamines? Competitive antagonism of histamine binding to cellular receptors, which are present on nerve endings, smooth muscles, and glandular cells. What are some examples of antihistamines? Brompheniramine, chlorpheniramine, pheniramine. What is the general mechanism of action for beta blockers? Heart beats more slowed and with less force, thereby reducing blood pressure. Beta blockers also help blood vessels open up to improve blood flow. What class of drug corresponds with the suffix -ol? Beta blocker. What are some examples of beta blockers? Metoprolol, propranolol, pundolol, timolol. What is the general mechanism of action for ACE inhibitors? Medications that slow the activity of the enzyme ACE, which decreases the production of angiotensin II. As a result, blood vessels enlarge or dilate, and blood pressure is reduced. What class of drug corresponds with the suffix -pril? ACE inhibitors. What are some examples of ACE inhibitors? Ramipril, lisinopril, benazepril, captopril. What is the general mechanism of action for loop diuretics? Act on the Na plus K plus 2 centiliter symporter in the thick ascending limb of the loop of henol to inhibit sodium, chloride, and potassium reabsorption. This is achieved by competing for the Cl binding site. What class of drug corresponds with the suffix -amide? Loop diuretics. What are some examples of loop diuretics? Furosemide, torsemide. What class of drug corresponds with the suffix -zolem? Clonazepam, diazepam, lorazepam, midazolam, alprazolam. What is the general mechanism of action for benzodiazepines? Enhance the effect of the neurotransmitter gamma-aminobutyric acid at the GABA receptor, resulting in sedative, hypnotic, anxiolytic, anticonvulsant, and muscle relaxant properties. What is the general mechanism of action for nitrates? Relaxes blood vessels and increases the supply of blood and oxygen to the heart while reducing its workload. What is the general mechanism of action for digitalis? Increases the force of the heart's contractions, which can be beneficial in heart failure and for irregular heartbeats. What are the indications of bronchoconstriction, respiratory distress and suspected bronchoconstriction? What conditions need to be met in order to give salbutamol in bronchoconstriction? Age, none level of awareness, none heart rate, none respiratory rate, none systolic blood pressure, none other, none. What conditions need to be met in order to give epinephrine in bronchoconstriction? Age, none weight, none level of awareness, none heart rate, none respiratory rate, BVM ventilations required systolic blood pressure, none other, history of asthma. What are the contraindications of salbutamol? Allergy or sensitivity salbutamol. What are the contraindications of epinephrine? Allergy or sensitivity to epinephrine. What is the dosage of salbutamol for a patient less than 25 kilograms? MDR rate, 1 puff every 4 breaths dose, 600 mcg/6 puffs dosing interval, 5 minutes max number sign of doses, 3 nebulizer dose, 2.5 mg dosing interval, 5 minutes max number sign of doses, 3. What is the dosage of salbutamol for a patient greater than 25 kilograms? MDR rate, 1 puff every 4 breaths dose, 800 mcg/8 puffs dosing interval, 5 minutes max number sign of doses, 3 nebulizer dose, 5 mg dosing interval, 5 minutes max number sign of doses, 3. What is the proper dosage equation of epinephrine? Intramuscular concentration, 1 mg per milliliter equal 1,000 dose, 0.01 mg per kilogram max number sign of doses, 1 for bronchoconstriction, 2 for anaphylaxis. What is a contraindication for the nebulizer? Fever, declared febrile respiratory illness outbreak. What are the conditions that need to be met in order to give epinephrine in moderate to severe allergic reactions? Age, none weight, none level of awareness, none heart rate, none respiratory rate, none systolic blood pressure, none other, for anaphylaxis only. What are the indications for moderate to severe allergic reactions? Exposure to a probable allergen and signs and/or symptoms of a moderate to severe allergic reaction to systems involved. What conditions need to be met in order to give diphenhydramine aka Benadryl in moderate to severe allergic reactions? Age, none weight, greater or equal to 25 kg level of awareness, none heart rate, none respiratory rate, none systolic blood pressure, none other, none. What are the contraindications for diphenhydramine aka Benadryl? Allergy or sensitivity to diphenhydramine aka Benadryl. What is the dosage of diphenhydramine aka Benadryl for a patient greater or equal to 25 kg and less than 50 kg? IV and IM dose, 25 mg dosing interval, none max number sign of doses, 1. What is the dosage of diphenhydramine aka Benadryl for a patient greater or equal to 50 kg? IV and IM dose, 50 mg dosing interval, none max number sign of doses, 1. What are the indications for nausea/vomiting? Nausea or vomiting. What conditions need to be met in order to give dimenhydrinate aka Gravol in nausea/vomiting? Age, none weight, greater or equal to 25 kg level of awareness, unaltered heart rate, none respiratory rate, none systolic blood pressure, none other, none. What are the contraindications for dimenhydrinate aka Gravol? Allergy or sensitivity to dimenhydrinate or other antihistamines, overdose on antihistamines or anticholinergics or tricyclic antidepressants. What is the dosage of dimenhydrinate aka Gravol for a patient greater or equal to 25 kg and less than 50 kg? IV and IM dose, 25 mg dosing interval, none max number sign of doses, 1. What is the dosage of dimenhydrinate aka Gravol for a patient greater or equal to 50 kg? IV and IM dose, 50 mg dosing interval, none max number sign of doses, 1. In order to administer dimenhydrinate aka Gravol through IV, what must you do first? Dilute dimenhydrinate aka Gravol with normal saline or sterile water with a ratio of 1:9. What are the indications for cardiac ischemia? Suspected cardiac ischemia. What conditions need to be met in order to give aspirin aka ASA in cardiac ischemia? Age, greater or equal to 18 years. Weight, none. Level of awareness, unaltered heart rate, none. Respiratory rate, none. Systolic blood pressure, none. Other, able to chew and swallow. What are the contraindications for aspirin aka ASA in cardiac ischemia? Allergy or sensitivity to ASA or NSAIDs, if asthmatic, no prior use of ASA, current active bleeding, CVA or TBI in previous 24 hours. What conditions need to be met in order to give nitroglycerin aka nitro in cardiac ischemia? Age, greater or equal to 18 years. Weight, none. Level of awareness, unaltered heart rate, 60 bpm to 159 bpm. Respiratory rate, none. Systolic blood pressure, normotension. Other, prior history of nitroglycerin use or IV access obtained. What are the contraindications for nitroglycerin aka nitro in cardiac ischemia? Allergy or sensitivity to nitrates, phosphodiesterase inhibitor use within previous 48 hours, SBP drop.